Hello, my name is Dr. Charles Durr, and if you're watching this video, you or a loved one most likely suffers from some sort of thyroid disease or dysfunction. And I'm here to talk to you about our thyroid recovery program today. Right. Now, for the purposes of this video, it's important to understand that I am certified in functional blood chemistry analysis. Now, I've been a practicing chiropractor for the last 12 years, but I've been personally trained by the author of this book, Dr. Tatis Karazian. This book is called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? Now, you can go to thyroidbook.com and learn more about his program and download a free chapter of this book. But Dr. Karazian has personally trained me in the techniques that he uses to restore thyroid health naturally without medication. Now, a basic review of thyroid anatomy. Now, it's a butterfly-shaped gland on either side of your Adam's apple, okay? And it's stimulated by the pituitary gland releasing thyroid-releasing hormone. Then the pituitary gland stimulates and produces TSH, which then causes the thyroid gland to produce T4 and T3. So TSH comes from the pituitary gland, which then is first stimulated by the hypothalamus. Right. Now, some thyroid symptoms, and the most common symptoms of a slow or a hypothyroid are fatigue, increased weight gain, morning headaches, depression, constipation, losing the outer third of your eyebrows, cold hands and feet, constipation, among many other symptoms, but those are pretty much the most common ones. All right. Now, it's important to understand that the thyroid gland is the engine for all metabolic activity, and it talks with your immune system, your gut, your brain, endocrine system. All have effect on each other. The thyroid regulates their metabolic rate, and the feedback then affects the thyroid's health as well. And so when we talk about the thyroid, it's just not maintaining your weight or so forth, your metabolic caloric intake and so forth. It actually is in charge of bone metabolism, the immune system, brain and nervous system, endocrine system, gastrointestinal function, liver and gallbladder, growth and sex hormones, fat burning, insulin and glucose metabolism, healthy cholesterol, and proper stomach acid. Every single cell in your body has a receptor for a thyroid hormone, and that receptor then is told what to do by that thyroid hormone. So if you have a problem with your receptors at each cell, there can be a breakdown in any and all of these metabolic activities. Right? Now, are your lab tests normal, but you still feel lousy? And that's the basic tenet of this entire book, because TSH, unfortunately, is the only test that's done, sometimes T4, sometimes T3, and it's a very bad indicator in general overall thyroid performance. Right? Now, when we look at lab ranges, it's important to understand that you get your blood work back from the doctor and you see the normal range and you see the abnormal. And those are considered lab abnormals. Lab abnormals are the average of everybody who gives blood. Now, if you use that, you're going to be lumped in a wider kind of bell curve that's often not very sensitive to finding problems before they become full-blown diseases. Right? Now, we use what's called a functional range. All right? Now, the functional range is a tighter value based on the average of healthy people. And if we just go with the abnormal values that are in the extremes of either end, you're not going to pick up the subtle differences in breakdown in your metabolic health by looking at just the laboratory ranges. Right? For example, glucose. The functional range is 85 to 100, whereas traditional range is 65 to 110. And for our purposes, if you are at 73, we consider you to be hypoglycemic. Now, TSH is another example. The functional range is 1.8 to 3.0. The laboratory range is much broader at 0.3 to 5.7. So when using a functional range, you can detect patterns in metabolic breakdown that allow us to treat naturally before these diseases become full-blown and untreatable by traditional methods. Right. Now, getting to the root cause of your problem is what we want to do. We discover what's causing the hypothyroidism, and what makes us different from each other doctor that you see is the amount of testing that we do. And let's go over some of those. Now, when we send out for a routine set of blood work, it'll be much different than you may have received going to your doctors. Most patients get 2 or 3 vials drawn. They have a Chem 12 at most. They probably have a TSH, maybe a T4, the lipid panel, and maybe a few scattered tests in there. What we do is a very complete metabolic panel. We do a lipid panel, we do a CBC with autodifferential, and we do a thyroid panel with antibodies. I can't tell you how many patients I talk to who've never had antibodies to their thyroid gland run. And they've been on Synthroid for 14, 20 some years. And no one knows why, but we run the antibodies, we find out they're positive 9 times out of 10. Now, a true functional thyroid exam is more than just TSH. It involves free thyroxine index, free T4, T3, free T3, reverse T3, TPO and TPG antibodies, TSH antibodies, and TBG levels. All of those things can become dysfunctional in some way because not just production of your thyroid stimulating hormone is important. It's the transport to the liver and the gut to be converted. Then we have to convert T4 to T3, and then it has to be transferred and transported to your cells. So all those breakdowns are detected by running these 7 tests and the antibodies. All right. So traditional, just running TSH and maybe a T4 won't give you any kind of thorough metabolic evaluation of your thyroid gland. Now, there are 6 major patterns as identified by Dr. Krasian in his book, and they are primary hypothyroidism. All right, so your thyroid is just working slowly. The second most common is hypothyroidism secondary to pituitary gland sluggishness. So if you're under a lot of stress, you have a lot of cortisol release, your pituitary gland becomes sedated or depressed, and it doesn't produce as much TSH as it should. So then the thyroid gland starts to slow down as well. We have thyroid underconversion, which means that you're not converting enough T4 into T3. We have thyroid overconversion, which is caused by an increase in testosterone. So you're converting too much and your cells become desensitized to the T3. We have TBG elevations from contraceptive use and increases in estrogens. And then thyroid resistance. So if you've been on a replacement hormone for any number of years, your cells can actually become resistant to having too much exposure to thyroid stimulating hormone. Right. Now, we do other testing besides a routine blood panel. It's important to get an idea of a person's general health by doing a few tests. And we do what's called an adrenal stress index. Now, adrenal stress index measures a salivary sample 6 times over a 24-hour period. And what we're looking for is your cortisol load at those particular times. And there's something called a circadian rhythm, and it has to be a certain point at 3 in the morning and a certain point at 3 in the afternoon. And we can see if your cortisol levels are too high, are they too low, are they inverted, are they maladaptive, or what have you. And so what we can do from there is support the thyroid gland, because its job is to help regulate blood sugar, and it's also to help maintain neurotransmitter performance. So it affects the brain and it affects your blood sugar. 2 very critical things for the performance of your thyroid gland. So we run an adrenal stress index as part of our metabolic care and testing. We do a DNA stool ecology profile. And the reason we do this is we want to see if you have bad bacterial overgrowth, not enough good bacteria in your gut. We want to see if you have parasites, yeast, fungus, or what have you. Because it's important to understand that 40% of your thyroid hormone is converted from T4 to T3 in the liver, and 20% is converted in your gut by bacteria. So if you have an absence of good bacteria, you lose 20% of your thyroid function. In addition, if you have what we call antigenic load, meaning you have a lot of bugs in your body, it will cause your immune system to be over-dominant towards Th1, which means that you're actively fighting an infection, which can drain the immune system, but also can spur an autoimmune attack on your thyroid gland, which I'll get into in a little bit. Right? We do food sensitivity testing, and particularly the big 5, as we call it: gluten, casein, egg, soy, yeast, and casein being milk. Now, antigens come in 2 forms. They come in bugs and they come in foods or pollutions and things like that. If you are allergic or sensitive to one of the big 5, it can be causing your autoimmune attack on your thyroid gland, what's called Hashimoto's disease. And gluten being by far the #1 offender. And if we do send you out for blood work and we see that your antibodies are positive, then we're going to want to know what's causing it. We have to test for bugs, we have to test for foods. If it turns out that you're gluten sensitive, it's imperative that you stop eating gluten permanently in order to have any chance of recovering your thyroid from its dysfunction. Right? So this is a stool test, very sensitive. Blood tests aren't as sensitive for food sensitivities. We test the IgG in the stool, and this is actual DNA testing that's sent to a lab, and it takes about 3 weeks of analysis to actually come back with the results. And we can also do a genetic test to see if you've inherited your your gluten sensitivity to see if you've passed it on maybe to your children or you've gotten it from your parents, so you can actually help them recover from potentially autoimmune diseases as well. Right. So the sensitivity testing, if you're an autoimmune, you're probably going to feel chronic pain and fatigue, frequent indigestion, fullness after meals, bloating after meals, frequent loose bowel movements, constipation, and potentially vomiting. These are classic signs that you have an autoimmune condition and a food sensitivity. Right. Now we also test for intestinal permeability, or what's called leaky gut syndrome. Leaky gut syndrome is when literally the colander, that is your intestines, have holes that are too big that allows undigested proteins, bugs, and impurities to get into your bloodstream. They are detected by your immune system as an attacking invader, and that spurs an autoimmune attack. Unfortunately, what happens is frequently our immune system loses the ability to differentiate between friend and foe. So you eat a food that you're allergic to, your body tags it as an invading bug, it starts attacking the food, and anything that looks molecularly like that food. And unfortunately, gluten and thyroid tissue look almost identical in their molecular structure. So that's why eating gluten can cause Hashimoto's disease. Now, it may be caused by an autoimmune disorder like I said, and so we do the testing. We test for bugs, we test for food sensitivities, we test for adrenal performance, and we test for leaky gut syndrome. And we have to identify those antigens to see if we can eliminate them and therefore control the autoimmune condition. Right. Now, I mentioned earlier Hashimoto's disease. That's when your thyroid can sometimes be fast but sometimes slow. If you have Hashimoto's, you may feel good for a month or two after starting an increased dose of thyroid replacement hormone, and then you kind of go back to your feeling lousy state. That's one of the key signs. But we do the test, so we look for TPO or TPG antibodies. That means you have Hashimoto's disease. If we look for TSH, that means you have Graves' disease. That means you have hyperactive thyroid gland, which is more of a dangerous condition that needs to be managed medically. But we can test for it, but then if we find it, we do send the person out for medical management for Graves' disease. But we do take care of Hashimoto's patients all the time. Right? So do you have an active antigen or immune dysregulation? Well, we don't know until we do the tests. All right? And our program is nutritionally based, so the patient has to be willing to make some lifestyle changes, remove foods that are on the no list from the antigenic load, and take care of the bugs and restore their gut function and so forth. And we have to put you on a specific diet, a regimen of nutrients, and what we do is frequent follow-ups and blood work to see if we're improving your metabolic health, your thyroid health, and so forth. So if you're willing to make a lifestyle change and you're committed to regaining your health naturally, and you want an evaluation in our office, feel free to either dial the number if you're getting this online, or you can fill out the form and we'll send you a free report. If you're an existing patient, please watch this with your spouse before your follow-up. Thank you.